Hello, my name is Brittany and I attend Midwestern State University. I'll be giving a presentation on my capstone project, Preventing Postpartum Hemorrhage today. Objectives. Preventing postpartum hemorrhage is the main topic of this presentation, which also includes a preview of an ideal proposal that focuses on positive patient outcomes. This topic focuses also on the patient that will be supported and promoted in the hospital setting for this ideal. In review will be rationale and purpose of preventing postpartum hemorrhage, background, which is also helping prevent postpartum hemorrhage, problem statement, PITCO format, literature review, proposal plan description, implementation of the proposal, evaluation of the proposal, and dissemination of research proposal. Postpartum hemorrhage. What comes to mind when you think postpartum hemorrhage? Many people think it's only loss of blood or hypertension. The true definition is excessive or severe bleeding after giving birth. In a clinical setting, postpartum hemorrhage is 24 hours after birth and onset. The first 24 hours are most critical to 12 weeks of severe bleeding. Postpartum hemorrhage is determined by the amount of blood loss. A mother in postpartum who has lost 500 milliliters after vaginal birth or blood loss of 1,000 ml after a C-section birth is considered to have a hemorrhage. Any mom is at risk for postpartum hemorrhage after birth, even if there are no risk factors before birth. Women usually die from postpartum hemorrhage because nursing and healthcare staff are not detecting early signs of postpartum hemorrhage. There is significant evidence that deaths from postpartum hemorrhage are the top 5 reasons for maternal mortality in women. According to Benstock, the case of postpartum hemorrhage is the 4 T's: tone of their uterine anatomy, trauma, tissue retained with clots, and thromboin. The most common issue with postpartum hemorrhage is uterine anatomy. Managing postpartum hemorrhage requires a patient and healthcare team to have great communication, measurement of blood loss, monitoring the mother's vital signs, and provide fluid replacement. Rationale and purpose. Nurses can miss patients who have early signs and symptoms of postpartum hemorrhage. Postpartum nurses fail to educate mothers by forgetting to educate on discharge, using medical jargon, and not assessing the mothers before discharge. There has been research shown that when nurses have effective training, it can help prevent and reduce postpartum hemorrhage or deaths. When nurses can identify or detect the risk factors and take preventive action for new mothers, they can have the best clinical practice. There are maternal deaths that occur from the first day, 48.9%. On days 2 to 7 is 24.5%. And between 8 days and 42 days is 24% for postpartum hemorrhage deaths. Background. Maternal mortality has doubled since 2021. Most deaths occur in the first week are due to hypertensive disorder and postpartum eclampsia. Deaths that occur from day 8 to day 42 are due to infection. A few risk factors for postpartum hemorrhage include placenta eruptions, long labor time, uterine anatomy, retained placenta, and multiple pregnancies. Postpartum hemorrhage is one of the top 5 reasons why maternal mothers die. Nurses should have the knowledge and annual training to recognize postpartum hemorrhage. PITCO question. In postpartum units, how does incorporating of mandatory education training modules compared to basic hospital orientation affect the prevalence of postpartum hemorrhage? Literature review. These literature review articles were searched from Google Scholar, PubMed, and Nursing Journal database were used to conduct research for this project. I used the following 9 articles and spent many hours researching each article to help to put it into practice of ways to prevent postpartum and reduce maternal deaths. Case study. Per ProPublic Journal, the lack of knowledge of nurses have about high-risk mothers. There was a study of 372 postpartum nurses who were not well educated on the danger of postpartum hemorrhage. The study showed that the nurses needed more training to be able to educate their patients. The study also showed that nurses spent little time helping new moms with instructions on after birth care. Furthermore, nurses were not following up after giving birth at the hospital, which put the patient at risk for postpartum hemorrhage or death. Proposal plan. Pre-hospital education, annual training, in-person training, online modules, lab stimulations, case studies, tests and quizzes, teamwork, postpartum discharge, post-hospital visit follow-up call. The stakeholders are providers, nurses, medical assistant, hospital managers, team leads, financial team, patients, and hospital educators. The stakeholders support this project proposal. Hospital educators, team leads, nurses, medical assistant, hospital managers, patients, and providers among the stakeholders. The stakeholder desire is to work as a team with nurses and provide and implement the proposed ideal. This guarantees a cooperative approach from all stakeholders and avoid or reduce postpartum hemorrhage. This offers the healthcare team to have a comprehensive approach as well. For this condition, patients' education is crucial. For this reason, it is essential that all nurses take part in training. Accomplishing so will be able to educate patients and provide better patient outcomes. Implementation. Mandatory annual training. Utilize hospital protocol before and after birth education and skills tests. In the beginning, a new intervention would be implemented, suggesting that nurses should be mandated to learn how to prevent and reduce postpartum bleeding. They ought to be aware of who qualifies as high risk, how to educate patients before giving birth, and the warning signs and symptoms. Following the development of a plan by the healthcare team aimed to gain knowledge and educate patients. Online modules, lab stimulators, unit education, and in-person training should be all required for nurses. The goal is for nurses to be able to teach information back to another nurse, have performance feedback, and ensure proper skills are being performed. Evaluation. Positive patient outcome, thoroughly postpartum assessment, review reduce maternal mortality rate, evaluate readmission rates, patient satisfaction audits, clinical audits, record and analyze incidents. To evaluate, we would conduct a clinical audit to assess the efficiency of this approach. The goal is to lower the frequency of postpartum hemorrhages, approximately treat them when they do occur, and lower the number of maternal deaths brought by postpartum hemorrhage. The evaluation will show if the implementations are effective. Dissemination. Continuing education, nurse manager, CEU and TBON platforms and social media. I was able to have an expert discussion with the unit manager to discuss methods of reducing postpartum hemorrhage after conducting my study on this topic. On this project, media was shared and viewed. The CEU and TBON platforms will additionally broadcast this project in reducing postpartum hemorrhage. It is common knowledge that social media, YouTube, and TikTok are effective channels for disseminating information to the public. Every nurse will be informed of the day and time for conducting continuing education, seminars, and training. Summary. Having to experience postpartum hemorrhage as a new mom can be traumatic. postpartum hemorrhage can lead to maternal death and the infant living life without their mom. Research has shown that postpartum hemorrhage deaths have decreased, but the number of mothers with postpartum hemorrhage have increased. Women have risk factors or have none at all and develop postpartum hemorrhage after birth. It is vital that all nurses working in the hospital are knowledgeable, well trained, and able to educate the patients after giving birth. It is imperative that the nurses know the risk factors and know what actions to take when the patient has signs and symptoms of postpartum hemorrhage. With the proper training, the nurses can prevent and reduce the number of mothers who are diagnosed with postpartum hemorrhage. Studies show that postpartum hemorrhage is at high risk in the first 24 hours and can happen up to 42 days. With nurses doing stimulation labs, annual online training, and be able to educate patients, this will give a start to being able to reduce and prevent maternal deaths. After the interview with the nurse expert, the goal is to be able to put this proposal into practice. Nurses will be able to improve postpartum care and patient outcome. I would like to say thank you for listening to my proposal and my ideals, and it was great to do this research and find more information.